Masteron is one of the most used anabolic steroids by bodybuilders during contest prep. From the amateur level to the top elite athletes, it is well known for its cosmetic and hard dry look. In this video, we'll dive deep into everything you need to know about Masteron, its history, medical uses, and unique properties. We'll also discuss how it is used in bodybuilding and other sports, covering its dosages, benefits, and side effects, and if Masteron should only be used during cutting phases only, or it has a place during the off-season. Also, we'll go over its usage among women. So, if you are a bodybuilder, athlete, or simply curious to know more about this compound, this video will provide all the answers for the questions that you have. So, let's get started first with the history and medical usage of Masteron. Masteron was first described in 1959. It was used for the treatment of advanced breast cancer in women because its virilization side effects for women such as voice changes and increased body and facial hair were considered much milder compared to testosterone. In the 70s and 80s, the usage of Masteron among athletes became very popular. However, the pharmaceutical companies started to discontinue its production as more effective therapies for treating cancer were found, like serums and aromatase inhibitors nowadays. And now, let's move to the structure and the characteristics of Masteron. Masteron is the trade name, but the chemical name is Drostanolone. It is a hormone derived from dihydrotestosterone, or DHT, and it comes in two forms: Drostanolone Enanthate, which is the long ester, and Drostanolone Propionate, which is the short ester. Both are the exact same compound. The only difference is the ester attached to the compound, and the ester determines the absorption rate of the hormone in the body after the injection, the half-life of the hormone, and the duration of its effect. The half-life of Drostanolone Enanthate is 5 to 8 days, while the half-life of Drostanolone Propionate is only 48 hours. This means injections of Drostanolone Propionate need to be more frequent to maintain stable hormone levels in the blood. It also means that propionate acts faster than enanthate, so you will notice the effect much faster than the enanthate ester. Also, it clears out of the body more quickly after stopping the hormone. In general, short esters tend to be more painful to inject compared to long esters. The anabolic androgenic ratio of Masteron is 25 to 40 anabolic and 62 to 130 androgenic. I will explain this in a second. The androgenic properties are simply the effects related to male characteristics. Things like deepening of the voice, increased body and facial hair, oily skin and acne, or aggression. But the anabolic properties are the effects that support the growth and repair of tissues, like muscles and bones. Things like increasing muscle mass by promoting muscle protein synthesis, improving bone density, and helping the body recover faster from workouts or injuries. All anabolic androgenic steroids have both androgenic and anabolic properties, but the ratio varies with each compound. This ratio is always compared to testosterone, which has a ratio of 100 to 100. This is why scientists created anabolic steroids, to increase the anabolic effects and reduce the androgenic effects to minimize side effects. Now, let's talk about Masteron usage in bodybuilding. Masteron is a highly favored anabolic steroid among bodybuilders, especially during cutting phases and contest prep, as it helps build lean muscle mass and strength without any water retention. Also, it is well known for its cosmetic effect when you have low body fat levels. However, here is the biggest misconception. Masteron can be used in an off-season cycle to drive anabolism, as it helps to build lean muscle tissue and strength, and has a lower androgenic side effect profile. So, it can be run in higher dosages and for longer periods of time. But you shouldn't expect dramatic size increases from it. It is better for adding high-quality tissue in a steady way. Therefore, it is also used in speed sports to increase strength without adding unnecessary weight that may come from water retention. Okay, let's move on to the side effects of Masteron. Masteron is considered as an anabolic steroid with low androgenic side effects, but it is more androgenic than primobolan, which means it can cause more androgenic side effects than primobolan, like hair loss, body or facial hair growth, which makes primobolan a better option for women trying to avoid virilization symptoms. Masteron is 5-alpha reduced, which means it doesn't convert into DHT. So if you are experiencing hair loss while using Masteron, taking something like finasteride won't help. In general, users report feeling good and sense of well-being when using it at a moderate dosages, and it is well tolerated by most users. Regards its estrogenic side effects, Masteron does not pose any risk as it doesn't convert into estrogen. It actually does complete the opposite as it has anti-estrogenic properties. So there is no concern about gyno or water retention at all. And adding it to a cycle can help control estrogen levels instead of relying on aromatase inhibitors. Additionally, Masteron might help lower prolactin levels, which can be elevated by using nandrolone compounds like DECA, NPP, or Trenbolone. So, by adding Masteron to the cycle, you can control prolactin levels to some degree, potentially reducing or even eliminating the need for something like cabergoline. Regarding the liver, Masteron is not a C17 alpha-alkylated compound, and it is not known to have any side effects on the liver. And now, let's talk about Masteron cardiovascular side effects. All anabolic androgenic steroids have a negative impact on lipids. They tend to decrease HDL, which is known as the good cholesterol, and some of them may increase LDL, which is known as the bad cholesterol. All DHT derivatives, like Masteron, are well known to be harsher on the lipids compared to other compounds. So this is something to keep in mind when Masteron is used in high dosages. But of course, oral compounds are the harshest on lipids. Additionally, all anabolic androgenic steroids, including Masteron, can raise blood pressure. So it is essential to monitor your blood pressure on a regular basis and keep it under control. Before we talk about Masteron and testosterone suppression, if you find value in this video, please give it a like. The usage of all anabolic androgenic steroids will cause natural testosterone suppression. So, testosterone should always be the base for any cycle, as it is the primary hormone that the body relies on for proper function. And it converts into DHT and estrogen, which are necessary hormones not only for overall body function, but also essential for muscle building purposes. It is most likely that the recovery of your natural testosterone production should return after using Masteron and taking post-cycle therapy or PCT, but it may be also return without PCT. It could just take much longer. So, taking a PCT, in my opinion, is the better option. Instead of rolling the dice and see if your natural testosterone production comes back on its own. Or you may never recover 100% at all. There is always a risk when you use anabolic androgenic steroids that you might never return to normal. Even though it is rare, especially in the beginning, it would be completely irresponsible if I didn't mention this. In the case if you plan to use anabolic androgenic steroids long-term anyway, in my opinion, going back to TRT would be the better option, as you will anyway depend on TRT after years of cycling on and off. And now, let's talk about the dosages of Masteron for medical conditions and among athletes. The prescribing dosages for advanced breast cancer treatment in women were 100 mg administered 3 times per week, which is 300 mg per week total, taken for a minimum of 8 to 12 weeks, which is a pretty high dose for women. Therefore, virilization symptoms were very common. However, the most common dose among women in fitness and bodybuilding is 50 mg per week. But of course, the virilization symptoms cannot be completely excluded, especially at higher dosages and prolonged use. For men, the dosages vary a lot. Some people start at only 100 mg as a combination with TRT or testosterone replacement therapy, which is really not TRT anymore. It is just a small cycle. During a cycle, some users prefer to run a high testosterone dose combined with lower dose of Masteron as a secondary compound. And in the recent years, many users have shifted towards low testosterone doses, preferring to run Masteron as the primary driver for anabolism in the cycle. And the dose can go up to 1,500 milligrams per week or more. That depends on the level of the athlete's experience and physique development. Some users prefer primobolan over Masteron in bulking cycles, but to be honest, the outcome will be very similar. There might be a potential for better health markers with primobolan compared to Masteron. So you have to try it for yourself and see what works better for you. and also evaluate the effect of each on your health markers. Let's move now to the next point, which is Masteron availability and supply. It is very unlikely that you will find Masteron as a pharmaceutical product nowadays. The products you come across will mostly be produced by underground labs. You will typically find the shorter ester, Drostanolone Propionate, in a 100 mg concentration, available in 10 ml multi-dose vials or ampoules, but you will find the long ester, Drostanolone Enanthate, usually in a 200 mg concentration, also available in 10 ml multi-dose vials or ampoules. You will find Masteron under different brand names in the market, such as Mastabolic, Mastabolin, Mastabol. These are just brand names, but the compound itself remains the same, Drostanolone. One significant advantage of Masteron is that it is not commonly faked, unlike Primobolan, which is also a DHT derivative and shares many similarities with Masteron, which we will discuss in the next video. So subscribe to the channel and hit the notification bell to get notified when I upload the next video. Thanks for watching and see you in the next video.